When you look at what Complete Health is trying to do, we are trying to take better care of our patients. We're putting the patient at the center of our universe. And so the only way to take really good care of patients is to have really good providers.
When I'm talking to physicians that are considering selling the practice, it usually falls in three different things that are important to them. Financial considerations, what's in the best interest of my patients on a go-forward basis, and also for the staff. On the financial side, when a doctor goes to sell his practice, he usually has a couple different options. One of those is to sell to a local hospital system. And hospitals typically are going to pay the least amount because they can't put what's called intangible value on the practice. We can. So we typically can have a better offer financially for the doctor. Also on the financial side, most folks that sell to us are looking to work another 5 or 10 years. So you have to say to yourself, what's your income level going to look like once you sell the practice?
We are a well-run, fiscally sound organization that raises compensation for our providers. And by way of example, our average primary care physician made 37% more in annual compensation than they did prior to joining Complete Health. Not only do you have an opportunity to lessen the administrative burden on yourself, but you have the ability to focus more on your patients and make more money personally than you have before.
One thing that sets Complete Health apart from other value-based care providers is the fact that we are a physician-led organization. I think that's probably the most important component of what we do differently.
They have a lot more freedom and they have a lot more power over the care of their patient, and that's important. Because what we found is the doctors we speak with, they're good folks and they know what to do. And if you give them the power and the resource to do it, they can typically generate much better outcomes. At Complete Health, we're a growing company with lots of resources. As it relates to their staff, we have career advancement, we have career training, and we also have a full range of benefits, which a lot of times you don't see on the smaller practice levels. So we're very proud of the fact that we can offer those benefits. Another key element we have is our member support representatives that are based in the practice, that are there at the behest of the doctor to help the patient navigate through their insurance options, to help with referral, to get them in for transportation. There's a lot of resources we have that we can deliver a better experience for the patients besides the care, just getting them access.
We really try to focus on what can we take off of the backs of the providers so they can really do what they want to do, which for you guys as providers is take good care of patients, enjoy your job, and really help people. That's why you went into healthcare in the first place.
If you're interested in learning about what your practice is worth, about what options you have, what the process would look like, I invite you to reach out to me to have that discussion on a confidential basis.